He was the most famous man on earth, also the most scrutinized. For decades, the world watched his face change. Tabloids printed side-by-side photos with arrows. They called him names. They treated his face like a crime scene. But the medical truth is far more complex. A story of fire, of pain, of autoimmune disease, and of relentless perfectionism. This is not a judgment. This is a medical timeline. A story written in scars. Let's start with the nose. In his 1988 autobiography, Michael said he had 2 rhinoplasties. He wrote about it casually. His mother, Catherine, confirmed this publicly. She said she tried to stop him after the second. She made him promise. The first was to sing better, he once joked. The second was to fix the first. 2 surgeries. That was the official story for years. The public was expected to believe it. The autopsy tells a deeper truth. On June 25, 2009, Michael Jackson died at age 50. Dr. Christopher Rogers, the chief medical examiner, performed the examination. He found evidence of multiple rhinoplasties, not 2, multiple. The nasal bones were described as extremely thin and fragile. They had been reduced so much that structural integrity was compromised. The nostrils were supported by cartilage grafts taken from his ear. The ear had been harvested for parts to rebuild the nose. This is a technique used when original cartilage is depleted. This is not the sign of 2 simple surgeries. This is a nose operated on repeatedly, each time removing more tissue, each time requiring a more creative solution to prevent collapse. Dr. Stephen Hoffman was Michael's plastic surgeon in the 1980s, a renowned Beverly Hills surgeon, part of the inner circle. Years after Michael's death, Hoffman broke his silence. He admitted he personally performed 2 rhinoplasties on Michael, but he also stated other doctors operated on Michael after him. He said at least 3 more rhinoplasties were done by other hands. At least 3 more. The minimum total becomes 5, but many surgical experts who reviewed the autopsy findings and photographic timeline believe the true number is higher. They point to progressive narrowing, the pinched tip, the near disappearance of the nasal bridge. They discuss revision surgery spirals. One surgery creates an imperfection. The second fixes it but creates another. The third fixes that one but introduces a new variable, a chain reaction. The total number of distinct procedures on the nose alone is estimated between 5 and 10. Some say more. Each surgery meant general anesthesia. Each meant recovery time. Each meant hoping this time it would finally be right. To understand the face, you must understand the fire. You cannot separate them. January 27, 1984, Los Angeles. The Shrine Auditorium. Michael is filming a Pepsi commercial. He is 25 years old. He is at the peak of Thriller-era fame. The concept involves a staged concert. Pyrotechnics are planned. Explosions of light and smoke. On the 6th take, something goes catastrophically wrong. The pyrotechnics detonate too early. Sparks rain down on Michael's head. His hair, coated in hairspray, ignites instantly. Michael continues dancing for several horrifying seconds. He does not realize his head is engulfed in flames. The footage is difficult to watch. Crew members rush the stage. They tackle him. They smother the flames with hands and jackets. The damage is done. He is rushed to Cedars-Sinai Medical Center. He suffers 2nd and 3rd degree burns to his scalp and a small area of his face. The pain was unimaginable, the kind that changes a nervous system forever. He later called it the worst pain of his life. Pepsi settled out of court. Michael donated the $1.5 million settlement to the Brotman Medical Center burn unit. It became the Michael Jackson Burn Center. He turned tragedy into a gift. But his physical consequences were just beginning. This was the start of his surgical journey with his scalp. The burn was deep. It destroyed hair follicles. It destroyed skin layers. It needed repair for functional reasons, not cosmetic ones. Doctors used a technique called tissue expansion, a brutal, slow, painful reconstructive process. They inserted a silicone balloon under his healthy scalp skin. Over weeks and months, doctors periodically injected saline into the balloon. Each injection stretched the skin further. Michael walked around with a balloon under his scalp, slowly expanding, creating a bubble of stretched, healthy skin. The pressure was constant. The discomfort was chronic. Once the skin was sufficiently stretched, he underwent another surgery. The balloon was removed. The newly stretched healthy skin was pulled over the burned area to cover scarred, hairless tissue. This is a flap surgery. The autopsy confirmed all of this. A scar behind his left ear, the donor site, a linear scar across the top of his head, the edge of the flap, multiple smaller scars from expander insertion points. These were not cosmetic choices. These were reconstructive procedures to repair traumatic injury. He did not choose this surgery. It was forced upon him by a terrible accident, but it marked the start of a long relationship with surgical recovery on his scalp. The area became a landscape of scar tissue. Scar tissue has no hair follicles, no sweat glands, limited blood supply. It is stiff, it is painful, it is a permanent reminder. But the scalp scars found in the autopsy were not just from the fire. The medical examiner found evidence of further surgical intervention. Scars behind both ears, not just the burned left one. These scars are textbook signs of a rhinoplasty, a facelift, also signs of a brow lift procedure. Incisions are made in the hairline and behind the ears. Skin is lifted, underlying muscles are tightened, skin is pulled back, excess trimmed. Result is a smoother, tighter forehead and higher brow. Doctors concluded Michael underwent several surgeries to tighten his forehead skin and lift his brows. Exact number unknown, but multiple scar lines, some older and some newer, suggest at least 2 or 3 such procedures. Combined with burn reconstruction and initial emergency surgeries after the Pepsi accident, total distinct scalp and forehead surgeries likely range between 3 and 5. Each was a major operation. Each required cutting into a scalp already compromised by burn scar tissue. Operating on burn scars is notoriously difficult. Tissue is less vascular. Healing is slower. Necrosis risk is higher. Yet he went back repeatedly to alter this part of his body. We cannot talk about Michael's skin without talking about his disease, the most misunderstood part of his medical story. For years, tabloids accused him of bleaching his skin. They said he hated being black. The accusations were cruel and medically false. Michael Jackson had vitiligo. The autopsy confirmed it conclusively. The coroner found depigmented patches of skin across his entire body. Vitiligo is a chronic autoimmune disease. The immune system attacks and destroys melanocytes, the cells producing skin pigment. This creates white patches that spread unpredictably. It is not contagious. It is not a choice. It is a disease. Michael first mentioned it publicly in a 1993 interview with Oprah Winfrey. The world largely did not believe him. He was accused of lying, but his dermatologist, Dr. Arnold Klein, confirmed it. The autopsy confirmed it. No ambiguity. This is why his skin tone lightened dramatically. The vitiligo had spread so extensively it covered most of his body. The treatment for widespread, treatment-resistant vitiligo is often total depigmentation, a medical process using prescription monobenzone cream. It is applied to remaining pigmented areas. It permanently destroys remaining melanocytes. The goal is uniform skin tone by removing remaining dark patches, not about changing race, about achieving a single, even color on a patchwork body. Medical treatment for a disfiguring condition. This depigmentation process is not a surgery, but it is a transformative medical procedure that permanently altered his appearance. It required rigorous application. It caused extreme sun sensitivity. It is irreversible. He was not trying to be white. He was trying to be uniform. He was trying to look normal. The vitiligo also explains the surgical masks, the umbrellas, the long sleeves, the hats. He was not eccentric for the sake of it. He was protecting skin that lost its natural defense against ultraviolet radiation. A sunburn on depigmented skin can be severe. It increases skin cancer risk. The accessories were medical necessity disguised as fashion. The autopsy was a map of his medical history. Read like a book by the examiner. Every scar told a story. Inside his mouth, on the inner cheeks, the buccal mucosa, there were small linear scars. Entry points for cheek implants. He had them. Implants placed through incisions inside the mouth to avoid visible facial scars. They gave his cheeks a higher, more sculpted appearance. They changed his face shape significantly. Under his chin, a small, faint scar was noted, the creation of his famous cleft. Michael was not born with a cleft chin. He had it made. Dr. Hoffman admitted he did that surgery twice. Michael was unhappy with the first result. The first attempt was too subtle. The second was more defined. Again, multiple surgeries. Again, the pursuit of a specific ideal. Again, anesthesia, recovery, and deciding it was not enough. His eyelids showed evidence of blepharoplasty, eyelid surgery. Removing excess skin and fat from upper or lower eyelids creates a more open, rested appearance. The autopsy noted telltale signs. His lips showed evidence of surgical alteration. Exact nature not fully documented, but tissue showed signs of intervention. Speculation about lip reduction or reshaping persists. Dental records were extensive. Multiple implants, veneers, restorative work. His famous warm smile was heavily maintained through surgical dentistry. These were not life-saving procedures, not forced by fire or disease. These were aesthetic choices, alterations in a quest for a particular look. Each required anesthetic. Each required healing. Each scarred a body already bearing immense trauma from fire and vitiligo treatments. The cumulative effect of all facial surgeries was profound. The face seen in his final years resulted from dozens of individual decisions spread over decades, each adding a new layer of surgical history onto the canvas of his face. In 1999, a new kind of trauma entered. Michael performed at a charity concert in Munich, Germany. Michael Jackson and Friends. A benefit for children. During Earth Song, a stage bridge malfunctioned. It was supposed to rise dramatically. It collapsed from significant height with Michael on it. The platform crashed down hard. The crowd screamed. For a moment, no one knew if he was alive. Then, incredibly, Michael Jackson stood up. He emerged from wreckage, covered in dust and debris. He finished the song. He danced. He hit his marks. He held the final pose. A true performer. The show must go on. But the adrenaline faded. He collapsed. He was hospitalized. Diagnosed with a fractured toe and, more significantly, a severe back injury. Spine damage was long-lasting. He underwent foot surgery for the fracture. He began treatments for his back. This began a new, tragic chapter. The Munich accident was the tipping point. Pain from the 1984 Pepsi burns never fully left. Multiple scalp surgeries left chronic nerve pain in his head. Facial surgeries added to the load. Now a catastrophic back injury layered on top. The human body can only take so much. Michael's body was a reservoir of accumulated trauma, relentless demands of performing, dancing, rehearsals, world tours, all done on a foundation of broken bones, scarred skin, and damaged nerves. Pain led him down a path of prescription painkillers, well documented. He received opioids for burn pain in 1984. He became familiar with their relief. After Munich, pain management became central to daily existence. This is not about plastic surgery anymore. This is about the physical toll of a lifetime under the scalpel. The body remembers every cut. The nervous system remembers every injury. By the end of his life, Michael was treated for chronic, systemic pain by multiple doctors. Medications were powerful. Doses were high. Dependence was severe. A desperate attempt to manage a body that had been through too much. Surgeries interacted dangerously. Repeated rhinoplasties narrowed nasal passages. Combined with scar tissue, breathing was likely compromised, possibly contributing to sleep apnea. Multiple scalp procedures combined with burn scars meant his head was a map of nerve damage. Chronic headaches were constant. Facial surgeries meant his face may have had areas of numbness or altered sensation. He lived inside a body altered so many times it was no longer a reliable source of sensory information. Pain signals were confused. Normal sensations might have felt like pain. Central sensitization, common in patients with long surgical histories. In his final years, Michael prepared for a massive comeback. This is it. 50 shows at the O2 Arena in London, sold out in minutes. Pressure was immense. He was 50 years old. His body was exhausted. Rehearsals were grueling. He needed to dance like he was 25. He needed to be the king of pop again. But his body failed him. He could not sleep without medical intervention. Pain was unmanageable without heavy sedation. This led to Dr. Conrad Murray, a cardiologist, administering propofol as a sleep aid in a home setting, an egregious breach of medical standards. Propofol is an operating room anesthetic, not a sleep medication, not for home use. On June 25, 2009, the system collapsed. Michael Jackson found unresponsive in his rented Holmby Hills mansion. The combination of propofol and other sedatives caused respiratory failure, pronounced dead at Ronald Reagan UCLA Medical Center. Official cause of death, acute propofol intoxication. Manner of death, homicide. Dr. Murray convicted of involuntary manslaughter. The autopsy was performed the next day, a document of immense public interest and sadness. It listed his height, weight, and the fact that he was a generally healthy 50-year-old man in organ function. His heart was strong. His liver was normal, no physical deterioration expected from a lifelong addict. He was not a frail skeleton. He was a man with a strong heart and a body marked by surgical history. Scars were listed one by one. Behind the left ear, behind the right ear, linear scar across the top of the head, multiple scars around the nostrils, under the chin, inside the mouth, the cleft scar, small depigmented vitiligo patches remaining on his skin, silent testimony to the disease he battled, tattoos on his eyebrows and eyelids, permanent makeup used to define features surgery and vitiligo had blurred, a tattoo on his scalp to camouflage scarred areas where hair would not grow. Over 13 distinct surgical scars on his head, face, and body were catalogued. The coroner also noted something surprising. Despite all surgeries, Michael Jackson's face was not disfigured. The work was skillfully done. Scars were well healed. He was healing well from his most recent procedures. The narrative that he was a monster, that his face was falling apart, was simply not true. He looked like a man who had extensive plastic surgery. That is undeniable. But he did not look like a freak. He looked like someone who had been under the knife many times and healed. The tragedy was not that his face was ruined. The tragedy was that he felt he needed to change it so many times. Why did he do it? The question lingers. Fire explains the scalp. Vitiligo explains the skin. But the rest? The cleft chin, done twice. Cheek implants, eyelid surgery, never-ending rhinoplasties, facelifts. What drove a man adored by millions to alter his appearance so radically? Answers are complex. He was a perfectionist. He never thought it was good enough. True of his music, his dancing, his short films, he rehearsed until collapse, he rewrote until perfect. The same psychology that created Thriller is the psychology that looked in the mirror and saw something needing fixing, repeatedly. He was deeply affected by his childhood. His father, Joseph Jackson, was harsh and critical. He allegedly mocked Michael's appearance, particularly his nose, calling him Big Nose, telling him he did not look like him. This emotional abuse landed on fertile ground. A sensitive, artistic child who became a global superstar. Psychological damage was done early. The scalpel became a tool to erase what his father mocked, a way to take control of his face when he controlled so little else. Dr. Hoffman said Michael brought pictures to appointments, not of celebrities but of mannequins. Perfect, idealized, slightly unreal faces. He was not trying to look like someone else. He was trying to look like art. He was sculpting himself into a living work of art. He was the canvas and the painter both. Body dysmorphic disorder fits, a mental health condition where a person obsessively focuses on perceived flaws. Flaws minor or unobservable to others. The person sees something grotesque in the mirror. They seek surgery. But because the flaw is psychological, surgery never satisfies. Temporary relief. Then dissatisfaction returns. Another surgery. Another. A recognized medical condition. Michael was never diagnosed publicly, but the pattern fits the clinical description closely. A tragic condition. The person suffers immensely, but the solution pursued cannot heal the underlying psychological wound. The story of Michael Jackson's surgeries is 3 categories. First, reconstructive, burn treatments, scalp expansions and grafts, medically necessary, forced by accident. Second, dermatological, vitiligo treatments, depigmentation therapy, medically necessary, response to cruel autoimmune disease. Third, cosmetic, rhinoplasties, cleft chin, cheek implants, eyelid work. Choices pursued in the name of perfection, driven by psychological forces no one will fully understand, the visible manifestation of an internal struggle. These categories overlapped and intertwined for decades. Burn treatments introduced surgical recovery and prescription pain medication. Vitiligo treatments radically changed his appearance against his will, perhaps fueling desire for more control through cosmetic surgery. Cosmetic surgeries created more scar tissue, more pain, and more need for medication. A cycle, a feedback loop, each element feeding the next. Physical pain feeding drug need, psychological pain feeding surgery need, surgery feeding physical pain. Around and around for 30 years, until the night it stopped. The official cause of death was acute propofol intoxication. Dr. Conrad Murray was responsible. But contributing factors were a body exhausted by injury and a mind trapped between unimaginable fame and constant physical suffering. The surgeries were not just about changing his appearance. They were a map of a life lived in fire, a map of a boy told he was ugly, a map of a man whose skin betrayed him, a map of a performer whose body was his instrument, constantly tuned and retuned until the strings broke. When looking at a photograph of Michael Jackson from the Jackson 5 era, then a photograph from the This Is It press conference, you are not seeing time alone. You are seeing a medical history, burn scars, graft sites, vitiligo patches, implant pockets, cartilage grafts, suture lines, injection points, a body that endured more than most can comprehend. Yet, when he stepped on stage, that body moved with a grace and power that was otherworldly. The ultimate paradox. The body was fragile, the spirit inside was indestructible. The face was a battlefield, the smile could still light up a stadium. The surgeries were many, the art was eternal. The man beneath the mask, beneath the scars, beneath the rumors, was simply a human being trying to find his way through an impossible life, using the only tools available. That is the story the scars have to tell.